I am starting anticholinergic drugs. Anticholinergic drugs are also known as parasympatholytic drugs. Parasympathomimetic nahi. Cholinergics are parasympathomimetic. Anticholinergics are parasympatholytic drugs. So let me start it. Okay. So this diagram, you are well aware of this diagram. So let me explain you once, those who have missed it, and I will come on the classification of the drug after it. You can see this is the brain here. This is the brain. This is the spinal cord here. This is the spinal cord. So you can see the brain, you can see the spinal cord. See, from the brain and spinal cord, one of the neuron is arising. This is the cell body of the neuron and this is the axon. The axon is known as nerve fiber. This is another neuron. This is the cell body of another neuron and this is the axon or nerve fiber of this neuron. So we can see two neurons. The junction of the two neurons is known as ganglion or it is known as synapse. It is known as synapse or ganglion, the junction. The first neuron is known as pre-ganglionic neuron. The second neuron is known as post-ganglionic neuron. So I can find out two neurons, pre-ganglionic neuron and post-ganglionic neuron and the junction, and this is the organ. This is the organ. The organ here is the smooth muscle. That is involuntary muscle. Smooth muscle or so here I have drawn heart, intestine. So all these organs are smooth muscles. The eye, these are not voluntary muscles. These are involuntary muscles. So it is supplying the involuntary muscles. On involuntary muscles, we have receptors on it. The name of the receptor is M and N, muscarinic and nicotinic receptors. So what exactly happened? Acetylcholine is secreted as neurotransmitter. So when wave of depolarization starting here, so in the brain, the wave of depolarization is coming. This is the wave of depolarization starting in the preganglionic fiber. So acetylcholine is released at the junction, at the ganglion. Then this neuron will get stimulated. The second neuron, postganglion neuron, it will get stimulated. So it will secrete acetylcholine at the organ. So this acetylcholine will bind with muscarinic and nicotinic receptor and show its action. So whatever action is shown by acetylcholine at the organ here, that is known as cholinergic action because it is shown by acetylcholine. So cholinergic action. So yesterday we have completed cholinergic drug. Today my chapter for teaching to you is anticholinergic drug. So what these drugs will do? Anticholinergic drug. Now when acetylcholine is secreted here, it will bind to muscarinic and nicotinic receptor. So depending on the organ, if the organ is heart, it will show its action, it will decrease the heart rate. If the organ is eye, the pupil of the eye, then it will cause meiosis in the eye. If the organ, if the organ is glands, any gland, salivary gland, lacrimal gland, it will increase the secretion of the gland. So depending on the organ, the acetylcholine will show different function. Yes or no? So this is the same diagram from KDT. Let me zoom out this portion for you. So can you see here, the yellow color is the ending of the postganglionic nerve fiber. This is the postganglionic nerve fiber inside which acetylcholine is formed. So when wave of depolarization is coming, this acetylcholine is coming out at the junction between the nerve and the organ. This green color is the organ. So this acetylcholine is coming out and this acetylcholine is binding with its receptor, the muscarinic receptor and nicotinic receptor, which are present on the surface, of these organs. The yet green colored organ is a smooth muscle here. It is any of the smooth muscle. It can be heart, it can be gland, it can be eye, it can be visceral organ, visceral muscle. Yes. So depending on the organ, all involuntary muscle organs, smooth muscles have muscarinic and nicotinic receptor. So this acetylcholine will bind to with the receptors and show its action. Now, and depending on the organ, these are the action. If it is heart, it is visceral smooth muscle, it is eye, it is gland, it is blood vessel, it is male sex organ, it is neuromuscular junction. So depending on the organ, it will show its action. These muscarinic and nicotinic are present everywhere. We know muscarinic receptors are of three types, M1, M2, M3. We know nicotinic receptors are of two types, NM and NN. So total 5 receptors we are having and its function is already shown in the image. Yes. Now my chapter to teach you today is anticholinergic drug. They block only muscarinic action. They have no effect on nicotinic action. So they reverse muscarinic action. So that is anticholinergic. Now anticholinergic is the misnomer. Actually cholinergic drugs are both. Muscarinic and nicotinic both actions are there in cholinergic drugs. So anticholinergic सुन के हमें ऐसा लगता है कि ये muscarinic और nicotinic दोनों का उल्टा करेगा, दोनों को reverse करेगा. No, it is a misnomer. It is a misnomer. It has no effect on nicotinic. It only reverse muscarinic effect. So muscarinic drugs, whatever muscarinic effects are there, M1, M2, M3, that will be reversed. So only muscar. So can you see here in the diagram, you can see a M receptor here, muscarinic and nicotinic receptor here. So what these drugs do, when I take a tablet of atropine or whenever I take dhatura or any anticholinergic drug, that will go inside me, that will be absorbed inside me, that will go in my blood, from the blood that will go at the junction of this neuron and the organ. At the junction, after going at the junction, it will bind with the muscarinic receptor. The drug, the anticholinergic drug, this is anticholinergic drug, the drug will not bind with nicotinic receptor. Please mind my words. It will bind with the muscarinic receptor and block it and just block it. So whenever wave of depolarization is coming and this acetylcholine is secreted, this acetylcholine cannot bind with the muscarinic receptor because it is already blocked by the drug. So acetylcholine cannot bind with the muscarinic receptor. It cannot show its action. So if it was a heart, if the organ is heart, then if acetylcholine was binding with muscarinic receptor, then acetylcholine was decreasing the heart rate, force of contraction and velocity of conduction. Acetylcholine was showing these three functions on the heart. But since now acetylcholine cannot bind with muscarinic receptor, since the receptor is blocked by anticholinergic drug, then heart rate cannot decrease. So it will increase. It will paradoxically increase. So increase in heart rate, increase in force of contraction, increase in conduction of velocity. So these drugs just do the opposite what acetylcholine was supposed to do on that organ. Depending on that organ, what is the organ? Give me a thumbs up if you got it. Everyone give me a thumbs up. That is the most basic thing I have taught you. If you can understand this, you can understand the chapter ahead very, very easily. So same thing is shown here also. You can see this is the first neuron. This is the preganglionic nerve fiber. This is the ganglion, junction of the two neurons. And this is the second neuron, postganglionic nerve fiber. This is the preganglion fiber. This is the postganglion fiber. You can see acetylcholine is secreted at both places. Preganglion also, postganglion also. The acetylcholine present at the postganglion is going and binding with the muscarinic and nicotinic receptors. So actually these drugs, anticholinergic drugs, block muscarinic receptor. They do not block nicotinic receptor again and again. I'm telling you, if you want to block nicotinic receptor, what you have to do? You have to take another class of drug which are known as neuromuscular blockers or ganglion blockers. That I will teach you some other day. Today I'm not teaching you these drugs. So these are the drugs. See here I have shown. These are the drugs which block. You can specifically see. These are the drugs which block only muscarinic receptor. These drugs have no effect on nicotinic receptor. Since the muscarinic receptor is blocked by them, so when acetylcholine is released from the nerve ending, this acetylcholine cannot bind with its receptor, muscarinic receptor. It can bind with nicotinic receptor, but it cannot bind with muscarinic receptor. So whatever action this acetylcholine was supposed to produce at that particular organ, opposite of that action will be produced because that action cannot happen, so uska ulta hoga. If it is a heart, normally acetylcholine was decreasing the heart rate. Now decrease of heart rate will not take place, increase of heart rate will take place because acetylcholine is absent. These drugs are not causing increase in heart rate. They do not have intrinsic activity. They just block the receptor. Since acetylcholine आके bind नहीं कर पा रहा, इसलिए reverse होगा. Done. Have you got it? Give me a thumbs up if you got it. Someone among the audience. So let me start the chapter. My chapter. That was an overview. कि हमें पढ़ना क्या है. So my chapter for today is anticholinergic drugs. Anticholinergic drugs I'm teaching you. So all chapters I teach in this headings only in the entire pharmacology. So first I will let you know the classification of this drugs, this class. Then I will tell you mechanism of action. The most important, I have already taught you mechanism of action in short. Then I will teach you action at various organs, all organs. Then I will tell you uses, the mnemonic for the uses, then contraindication and side effects, the way how to learn the uses and contraindication side effects. Most of the MCQs come from uses and contraindication and side effects along with mechanism of action. So you should know this all very clearly. So these are the headings under which you should describe each and every drug of pharmacology. So whenever you are reading pharmacology now, always make a habit, take a notebook, take a pen. Although I know the notes are available everywhere, the PDF you can download anytime and it is available in the market also. But take a notebook, take a pen. If you make your own notes now, you will never forget pharmacology. Studying pharmacology only one way, just write. जितना ज़्यादा लिखोगे उतना ज़्यादा retention होगा. Pharmacology is a volatile subject. Once you read, you will understand, but you will forget it very easily. So the way to understand and learn it permanently now, just to write it multiple times. So always take a notebook during listening my lectures. Also take a notebook and start making notes. So first, classification. All drugs you have to describe in these 5 headings. So one, pharmacokinetics is also important heading for some drugs, not for all. So classification, mechanism of action, actions, uses, contraindication and side effects. So let me start with the first heading, classification of anticholinergic drugs. So here you can see I divide anticholinergic drugs into three categories. Some of them are natural alkaloids, some of them are semi-synthetic derivatives, and some of them are synthetic. You know the difference between natural, semi-synthetic, and synthetic. Synthetic is artificial, purely artificial. These are partially artificial, and these are natural. So this is a way to classify. So first in classification, first always understand based on what things we are dividing the drugs. Yesterday I taught you the classification of cholinergic drugs. Yes or no? Have you remembered the classification? What was the classification? We divided it into two categories. Some were agonist and some were anticholinesterase, the blocker of cholinesterase enzyme. So that was the main category there. Here the category is natural, semi-synthetic, and synthetic. Let me tell you the three categories. So the three categories are in front of you. Let me tell you which among them are natural. Natural are only two, atropine and hyoscine. The another name of hyoscine is scopolamine. Very few students know it. So question coming on scopolamine is same as that of hyoscine. तो हायोसिन का ही दूसरा नाम है scopolamine. Learn it. Only two natural anticholinergic drugs we are having till date. So atropine and hyoscine. Hyoscine also known as scopolamine. Learn it. So these are the natural alkaloids. Done. Should I move to the semi-synthetic? Semi-synthetic I will derive from natural only. Natural से derive करूंगी. So from atropine I have derived these two drugs. So atropine methonitrate or homatropine. These two drugs are derived from atropine only. So these are semi-synthetic. Semi-synthetic. Atropine methonitrate or homatropine. Done. These two are derived from atropine. This is derived from hyoscine. Hyoscine butyl bromide. So hyoscine butyl bromide. And again these two are derived from atropine. Ipratropium and tiotropium. So these are the semi-synthetic. Total 5 drugs are there. Semi-synthetic. Coming on synthetic one, which are artificial, completely artificial. Coming on synthetic one. So in synthetic, the category depend on the uses. Some of them are anti-secretory, which decreases the gland secretion. The secretion from all glands in the body. That's why these are known as anti-secretory. Some of them are mediatrix. They act on the eye and they dilate the pupil in the eye. That's why these are known as mediatrix. Some of them are vesicoselective. They act on the bladder, urinary bladder, and they cause urinary retention. They just dilate the bladder and constrict the sphincter. So they cause urinary retention. So these are vesicoselective. They act on bladder only. And some of them act on brain only. And they are anti-Parkinson drugs. So depending on the organ, the one which act on eye are mediatrix. The one which act on urinary bladder are vesicoselective. The one which acts on brain, those are anti-Parkinson's. And the one which acts on glands, these are anti-secretory. So their action is also hidden in the name. So you have to learn the name. Anti-secretory में आपके कौन-कौन से आएंगे? Just read the name. The most important one is, the most important among them is propanthalin, oxyphenonium, glycopyrrolate. These are the important ones. Mediatrix में cyclopentolate and tropicamide. Very important. Tropicamide. Vesicoselective में oxybutylin. Yes. And anti-Parkinson's में trihexyphenidyl. So split it to learn it. The big names are there. So you have to learn the classification anyway. So that was the classification. Now let me tell you. All these drugs are blocking which receptor? Muscarinic receptor. Now muscarinic receptors are 3 now. M1, M2, M3. So कौन सी drug कौन सा muscarinic receptor? Nicotinic they do not block. वो मैंने चैप्टर के शुरू में ही आपको क्लियर किया है कि these drugs do not block nicotinic receptor. All of them block only muscarinic receptor. But which muscarinic? M1 ki M2 ki M3? Which of them is blocking which one? So all of them are blocking all three. M1, M2, M3. All these three receptors are blocked by these drugs. So since they are blocked by these drugs, so reverse will happen. Normally muscarinic receptor M2 is present on the heart. When acetylcholine is binding with it, it is decreasing. It is decreasing the rate, it is decreasing the force, it is decreasing the velocity. But since these drugs are blocking the M2 receptor on the heart, so acetylcholine cannot act on the heart. So instead of decreasing, increase in rate, increase in force of conduction, contraction and increase in velocity of conduction will take place. So these drugs will do just the reverse of this table. ये पूरे table को उल्टा दो, reverse कर दो. जहां decrease है वहां increase कर दो, जहां increase है वहां decrease कर दो. So that will be the action of these drugs. Yesterday I taught you this chapter very judiciously. This table very judiciously. So these are the actions of cholinergic drugs. उसका उल्टा कर दो तो anticholinergic बन जाएगा. Give me a thumbs up if you got it. Give me a thumbs up. So these all these drugs are non-selective. They block M1 also, M2 also, M3 also. Some of them are selective. Some of them are selective. Some of them block only M1. So two examples are there which block only M1. So that is pyranzapine and telenzapine. So these two are blocking only M1. Write the names here. Pyranzapine and telenzapine. These are M1 blockers. M2 blocker only one drug. Tripitramine. Tripitramine. So only one drug is there. That is tripitramine, which is blocking M2. M3 ka blocker again only one is there. Darifenacin. Darifenacin is there, which is blocking M3. So learn these specific for your MCQs. You have to learn it. Otherwise, apart from these, all these are non-specific. They block M1 also, M2 also, M3 also. Give me a thumbs up. Give me a thumbs up fast. If I'm asking for a thumbs up, just give it now. So I will come to know that you got the concept at least. So let me move. See here, atropine is the prototype drug of this chapter. Atropine. Atropine is the prototype drug. Prototype drug of this chapter is atropine. So I am starting with atropine. Atropine is obtained from a plant. The name of the plant is Atropa belladonna or dhatura in layman language. So atropine is obtained. It is a natural alkaloid. No? So naturally ये कहाँ से मिलता है? Naturally ये कहाँ से मिलता है? So naturally it is obtained from a plant. The name of the plant is dhatura. Dhatura, that is Atropa belladonna. So it is an anti-muscarinic drug. It is not anticholinergic. It is anti-muscarinic. It blocks only muscarinic receptor. It do not blocks nicotinic receptor. So atropine, we have already seen the classification coming on mechanism of action. So what these drugs will do, I have already taught you. Can you see here? These drugs are blocking muscarinic receptor. So when acetylcholine is coming out, this is acetylcholine, when it is coming out with the wave of depolarization, the receptor is not free. So acetylcholine cannot bind with the receptor. It will remain at the junction, but it cannot bind with the receptor because the receptor is already blocked. It is already blocked by the drug. It is blocked by the atropine or any anticholinergic drug. So it is already blocked by atropine. So acetylcholine cannot bind here. So whatever function atropine was supposed to show on this particular organ, whatever the acetylcholine was supposed to do, atropine will do reverse of it. So that is anticholinergic or anti-muscarinic action. So this is the mechanism of action. So what actually these drugs are doing? These are competitive antagonists at the muscarinic receptor M1, M2, M3. So they block M1, M2, M3. So they prevent the binding of acetylcholine with the M1, M2, M3. So they inhibit the muscarinic effect, which acetylcholine was supposed to show at M1, M2, M3. So reverse will happen. So yes, Shoaib, I hope you got the concept. Okay. So let me move ahead. So we are done with classification. We are done with mechanism of action. Who will help me in action? Actions बहुत easy हैं. Like it is like fun. इस पूरे टेबल का हमें रिवर्स करना है. We will do just reverse of this table. So first we will start with M1. We will do reverse these things. Then we will come on M2, reverse these things. We will come on M3, reverse these things. Then we will come on uses and adverse effects. So let me tell you the actions. Let me start with CNS. यहाँ से I am starting with CNS from M1. Normally acetylcholine come and combine in CNS certain areas in the brain, and it is helpful for memory. It is helpful for memory. Done. But here anticholinergic drugs will block those receptors in the CNS, and they prevent acetylcholine from binding in the brain. They prevent acetylcholine from binding in the brain. So they depress certain areas in the brain. Which areas? So you have to learn two areas. Vestibular area in the brain, or inner ear you can say, or basal ganglion area in the brain. So over these two areas in the brain, in the CNS, muscarinic M1 receptors are present. These M1 receptors are blocked by these drugs. So acetylcholine cannot bind with M1 receptors. So they depress vestibular area and they depress basal ganglion. But we humans are taking the advantage of these property of these drugs. Since they depress vestibular area causes motion sickness. So these drugs can be useful as an anti-motion sickness. You know what is motion sickness? Whenever some person travel via bus or via some vehicle, via car, the person feel nauseatic or vomiting. So vomiting with traveling is motion sickness. So it is due to the overstimulation of vestibular apparatus present in the inner ear. Since these drugs are blocking the vestibular apparatus, they are depressing the vestibular apparatus. So these drugs are useful for anti-motion sickness. Name one drug among them. From the classification, which drug we are using for anti-motion sickness? We do not use all drugs. We use hyoscine. So typically hyoscine के tablets आते हैं for anti-motion sickness. So hyoscine ke patch are also available, transdermal patch for anti-motion sickness. So you one day you are going to get your degree, you will become doctor. Your neighbor is asking to you, doctor, I am having motion sickness. It is very common. So give me some tablet. I have to travel somewhere in bus and there is no other option. I have to travel only. So I will feel nauseatic. So beforehand only I will take that tablet as prophylaxis. So prescribe me some tablet. So you have to prescribe hyoscine to them. So because it has anti-motion sickness property. Give me a thumbs up if you got it. Or the second property, it depress basal ganglion. It suppress the M1 receptor present in the basal ganglion. Overstimulation of basal ganglion leads to Parkinsonism. So since it depress basal ganglion, it is helpful in anti-Parkinson drug. As an anti-Parkinson drug, we can use it. Done. So these are the two uses where in CNS, it is blocking two areas in the CNS. It is blocking vestibular apparatus and it is blocking basal ganglion. Since it is blocking vestibular apparatus, it is useful as anti-motion sickness drug. Anti-motion sickness drug. Since it is blocking basal ganglion, these are useful as anti-Parkinson drug. Anti-Parkinson. Give me a thumbs up. So there are two properties of this drug. In the brain, they are blocking two areas. I'm teaching you anticholinergic drugs. In the brain, anticholinergic drugs, M1 receptors are present. M1 receptors are present in vestibular apparatus and basal ganglion. These drugs block both. Block M1 receptors on vestibular apparatus also, M1 receptor on basal ganglion also. Overstimulation of vestibular apparatus leads to motion sickness. That's why these drugs are useful as anti-motion sickness. And overstimulation of basal ganglion leads to Parkinsonism. So blockage of M1 receptor over basal ganglion leads to anti-Parkinson's effect. Give me a thumbs up. I tried my best. Give me a thumbs up. Done. Yes. So coming on M2 receptor, which is present only on one organ, heart. Only on one organ, heart. Let me draw a diagram for the heart. So you can see this is the heart. These are the four chambers of the heart. This is the left side. This is the right side. You can see this is left atria. This is left ventricle. This is the wall of the left ventricle. You can see the wall of the left ventricle. Very well formed wall of the left ventricle. In left ventricle, you can see the receptors. So M2 receptors are present over the wall of the left ventricle. Over entire heart, I am drawing only left ventricle. So M2 receptors are present. M2 receptors are present everywhere. So when acetylcholine is coming, this is the nerve. This is the nerve. So when acetylcholine is secreted here from the nerve, this acetylcholine was binding with the M2 receptor, and after binding with the M2 receptor there in the heart, it increases the heart rate. It was decreasing the heart rate, it was decreasing the force of contraction, it was decreasing the velocity of conduction. So acetylcholine was negative inotropic, negative chronotropic, and negative dromotropic. Yes or no? It was acetylcholine doing. But whenever we give atropine or any other anticholinergic drug, so what these drugs will do? These drugs will block M2 receptors everywhere in the heart. So these M2 receptors are blocked now. So when acetyl acetylcholine is secreted from the nerve. Acetylcholine cannot bind with the receptor now because it is blocked by the drug. These M2 receptors are blocked. So acetylcholine cannot bind with these receptors. So instead of decreasing rate, force and velocity, there will be increase in rate, increase in force or increase in velocity of conduction. So can I say atropine or anticholinergic drugs are positive inotropic, positive chronotropic and positive dromotropic because they increase the rate, increase the force of conduction, increases the velocity of conduction. Give me a thumbs up. I tried my best. So that is on heart. So in short, in heart, they increase all these three things, rate, force and velocity. They cause tachycardia. So they cause tachycardia since they increase the rate of the heart. That's why they cause tachycardia. So they are useful in heart block. If some patient is having bradycardia or if some patient is having heart block, I will give these drugs to them. So the heart rate will increase, force will increase, conduction will increase. So in MI, in bradycardia, in heart block, these drugs are useful. Again, give me a thumbs up. I tried my best. So that is M2. M2 receptors are blocked over the heart and we have utilized this property in treating bradycardia. In treating bradycardia में heart rate कम हो जाती है and these drugs are increasing heart rate. MI में force of contraction कम हो जाता है. These drugs are increasing force of contraction. Heart block में velocity कम हो जाती है. Velocity of conduction from SA node to AV node. So these drugs are increasing the velocity. So these drugs are increasing the rate, increasing the force, increasing the velocity. So we took the advantage of these three properties for treating three diseases. So ब्रेडी में हार्ट रेट कम होता है तो ये बढ़ा के उसको ठीक कर देंगी. एमआई में फोर्स ऑफ कॉन्ट्रैक्शन कम हो जाता है तो फोर्स ऑफ कॉन्ट्रैक्शन को बढ़ा के उसको ठीक कर देंगी. हार्ट ब्लॉक में वेलोसिटी ऑफ कंडक्शन फ्रॉम एसए नोड टू एवी नोड कम हो जाता है तो ये वेलोसिटी ऑफ कंडक्शन बढ़ा के हार्ट ब्लॉक को ठीक कर देंगी. सिंस दीज ड्रग्स आर पॉजिटिव आइनोट्रोपिक, पॉजिटिव क्रोनोट्रोपिक एंड पॉजिटिव ड्रोमोट्रोपिक. गिव मी अ थम्स अप. इससे इजी कोई नहीं पढ़ा सकता तुम्हें. हैव यू गॉट इट? सो दैट इज द M2 ब्लॉकर का हमने यूज कहां पे लिया. M1 blocker का यूज कहां पे लिया. M1 receptors are present in the brain. In the brain at two places these M1 receptors are present. In the vestibular apparatus, in the basal ganglion. M1 receptors are present. These drugs block M1 receptor over both of them. तो वेस्टिबुलर apparatus को ब्लॉक करने की वजह से there is anti motion sickness property. We utilize this property for motion sickness. And basal ganglion को ब्लॉक करने की वजह से there is anti Parkinsonism property. So we utilize this property for treating Parkinsonism. So I am teaching you uses also. Actions के साथ साथ parallel uses भी चल रहे हैं. Give me a thumbs up. So I am coming on M3 receptors. I hope you people are enjoying and you people are with me. Let me see. M3 receptors. M3 में सबसे पहले visceral smooth muscle. I will teach you three organs in visceral smooth muscles. Yesterday also I taught you three organs here. GIT, urinary bladder and lungs. I will teach you all three organs one by one in visceral muscles. So let me start with GIT. Then urinary bladder, then lung. So let me start with GIT. I would like to draw a diagram for you. You can see this is large colon, large intestine. This is cecum. This is appendix. This is ascending colon, transverse colon, descending colon, rectum, and this is the anal sphincter. This is anal sphincter. You can see. So the whole GIT have smooth muscles inside it, which causes peristalsis. This is the smooth muscles. This is the smooth muscles present in the wall. This is the smooth muscles present in the wall of the GIT, and this is the muscle of the sphincter. So all this are having M3 receptors on them. Let me draw a few of them. So M3 receptors are present in the wall muscles also, muscularis propria, and M3 receptors are present over sphincter also. So these M3 receptors are present everywhere, and this is the nerve. Let me draw a nerve. So this is the nerve. So this is the nerve here also. This is the nerve here also. So from the nerve, acetylcholine is released. When acetylcholine bind with M3 receptor here and M3 receptor here also, in the sphincter also. So this acetylcholine, what it was doing? It was contracting these muscles. The acetylcholine was contracting the wall muscle. The wall muscle were show contraction by acetylcholine, and sphincter were relaxed. Now these drugs are blocking M3 receptors. Anticholinergic drugs, atropine is blocking M3 receptor everywhere. So acetylcholine is present, but it cannot bind with its receptor. So reverse will happen. These muscles will relax and these muscles will contract. Sphincter wali contract करेंगी. So these will relax. The peristalsis muscles will relax and the sphincter will contract. Imagine a intestine. Imagine an intestine in which the all peristaltic muscles are relaxed. They are not doing peristalsis. They are not contracting. They are not doing peristalsis. They are relaxed, and the sphincter is contracted. Is not relaxing. Sphincter is contracting. So feces will remain inside only. Feces cannot come out because peristalsis be absent hai or sphincter be contracted hai. So they causes constipation, you can say, or else you can say they are utilized for treating diarrhea. So this property can be utilized for treating diarrhea. Give me a thumbs up again if you got it. So this property we can utilize for treating diarrhea. So in the stomach and intestine, the contractions are reduced or the sphincter is more contracted. So spas can be relieved or diarrhea can be treated. Same can happen with urinary bladder. You can see this can happen in the intestine. You can see the diagram of the intestine. So these muscles are relaxed. These one in the wall, these are relaxed because acetylcholine used to contract it. So they will use to relax it. And sphincter one is contracted because acetylcholine used to relax the sphincter. So they used to contract the sphincter. Yeah, acetylcholine ka ulta karengi. These drugs done. So combining both of them, they decreases the evacuation of feces. Evacuation of the feces is decreased by these drugs because the muscles, so the decreased evacuation of the feces, so they are used as anti-diarrhea and they are used as anti-spasmodic. So two properties utilized based on this thing. So let me draw another diagram for you for the urinary bladder. So can you see, this is a urinary bladder, this is the urethra, and this is the sphincter. Again sphincter is there. So the muscles, there are muscles present over in the wall. These muscles are known as detrusor muscle. And there are muscles present over the sphincter. These are known as sphincter muscles. M3 receptor is present on both of them. So again, M3 is present over detrusor muscle also. M3 is present over sphincter also. M3 is present over sphincter also. So when acetylcholine is combining with M3 receptor over detrusor and sphincter, so acetylcholine at M3 receptor, it was causing contraction, and at sphincter it was causing relaxation. And these drugs will do the reverse. These drugs will block the M3 receptor. So they will prevent acetylcholine from combining with M3 receptor. So at the detrusor, they will relax the detrusor and they will contract the sphincter. So same with GIT. GIT maybe they are relaxing here the detrusor and contracting the sphincter. Imagine a bladder जिसमें पूरा detrusor relaxed है और sphincter contracted. Detrusor relaxed है, sphincter contracted है. मैं फिर से बोल रही हूँ. Detrusor relaxed है, sphincter contracted है. Urine will not come out. So these drugs causes urinary retention. These drug causes urinary retention. Now urinary retention कराती है इसको, या तो side effect ले लो या तो इसका use लेना है. If you want to use this property, the name of the disease is anuresis. What is anuresis? The name of the disease is anuresis. Anuresis is bad wetting. Bad wetting. If some person passes urine in the bed up to 6 years of age, it is normal. So it is normal for the child. Up to 6 years, it is normal that they do bed wetting in the night, especially when the child is sleeping. They are passing the urine in the bed only. They are not going in the toilet because their sphincter muscles are not very much developed, you can say, and they are not getting the signals properly done. But after 6 years, if some person is passing urine in the bed, the disease is known as anuresis. Anuresis. So what I will advise to such person, first the bladder training, that is sphincter को कैसे contract करना है, relax करना है, that is behavioral therapy. After that, if some tablet has to be given, some medicine has to be given, I will give anticholinergic drug or atropine to such patient. So before just sleeping, going to the bed in the night, they have to take anticholinergic drug. So after taking anticholinergic drug, if they sleep, their detrusor will relax and their sphincter will contract. So during the whole night, they will not pass urine. So this is the property we are utilizing here. So anuresis is the name of the disease. So हर property का side effect भी है, utilization भी है. GIT में भी same thing था. GIT में constipation कराते हैं, ये side effect है. यहाँ पे urinary retention कराते हैं, ये side effect है. और वहां पे anti diarrhea, यहाँ पे anuresis. ये use है. So every property we can use in positive way also, in negative way also. So negative ways are the side effects, positive ways are the uses. So pharmacology is very easy. It is like mathematics. You should understand the concepts, just apply those concepts. Done. So this is the way you should study pharmacology, I guess. Should I proceed ahead? So this is the urinary bladder. You can see here. You can see this is the detrusor muscle. So here detrusor muscle is relaxed. And this is the sphincter. The sphincter is contracted. So they do urinary retention because of this property. And these drugs are contraindicated in BPH because they increases the chances of urinary retention. So that was, and coming on the third is lung. Third organ here is lung. So in lung, what they do, so these are the two lungs you can see. This is the trachea, this is the bronchi, and these are the lungs. So trachea, bronchi, and lungs have M3 receptors present on them. So these are the M3 receptors present all over the lung. Normally acetylcholine come and bind with the M3 receptor. So acetylcholine come, bind with the M3 receptor, and it contracts the lung. Acetylcholine causes contraction of the lung, contraction of the muscles. So these drugs, what they will do? They will do the reverse. They will block M3 receptor. So acetylcholine cannot bind with the receptor. So acetylcholine cannot do the contraction. So they relax the lung. They cause relaxation of the bronchial muscles. So since they cause relaxation, they are useful in asthma. Since they cause relaxation, they are useful in asthma. Yes or no? So these drugs are useful in asthma. So based on this property, I have told you three uses. So based on GIT, they are useful for anti-diarrhea. Anti-diarrhea. Based on urinary bladder, they are useful in enuresis. Anti-diarrhea and anti-spasm also. Anti-spasm. They are useful in enuresis. And based on lung, they are useful in asthma. So I have told you three uses here. I have told you three uses in N2 also. Since they increase rate, that is they cause tachycardia, they are useful in bradycardia. Since they increase force of contraction, they are useful in MI. In MI, force of contraction is decreased. So they are increasing it. And since they increase the velocity of conduction, they are useful in heart failure. In heart failure, velocity is decreased, so they increase and again maintain it. Here, based on CNS, I have told you two uses: Parkinsonism and motion sickness. So they block M1 receptors on vestibular apparatus. So they are useful in motion sickness, and they block M1 receptor present on basal ganglion. So they are useful in Parkinsonism. So we are studying uses, side effect together. So the positive things we take in uses, negative things we will take in side effect. Give me a thumbs up, everyone. I hope you all are getting, and I'm getting a good response from you people. Okay. So coming on the next use, that is eye. Eye is always difficult portion here. Eye. So yesterday also I taught you eye here. Okay, in eye we have two type of muscles: iris muscle and ciliary muscle. Okay, I will go in the detail. In the eye, humans have two types of muscle: iris muscle and ciliary muscles. Ciliary muscle. Iris muscles are of two types, that is sphincter pupillae and dilator pupillae. So iris muscle, they will manage the pupil. So they will manage pupil का size. Pupil का size कम करेंगी और ज्यादा करेंगी. That is, they will do meiosis and mydriasis. So sphincter pupillae will cause meiosis. When sphincter pupillae is contracting, it is causing meiosis. As the name indicates, sphincter. Sphincter मतलब sphincter होगा. So they will cause meiosis. They will reduce pupil size. And dilator मतलब dilate होगा. So dilator pupillae will cause mydriasis. Mydriasis, that is, they increase the pupil ka size. This is normal. So iris is related to pupil, iris. Ciliary muscles are not related to pupil. Ciliary muscles are related intraocular tension of the eye. That is aqueous humor kitna hai anterior chamber mein. So ciliary muscle, if they contract, they decrease IUT. And if they relax, they increase IUT. If you understand this now, understanding chapter will be fun for you. The eye portion for the 4 chapters: cholinergic, anticholinergic, adrenergic, anti-adrenergic. We have to study 4 chapters, right or not? So in the 4 chapters, you have to tell me which drug causes what thing to iris, whether the drug is meiotic or mydriatic, and which drug is causing what to ciliary muscle, whether they are increasing IOT or decreasing IOT. The drugs which decreasing IOT are useful in glaucoma. The drug which increases IOT, they are contraindicated in glaucoma. So ये glaucoma के लिए useful है, कौन सी drug देनी है, कौन सी नहीं देनी है, और meiosis mydriasis भी useful है. Have you got it? These are the basics. Very few student knows these basics. I had they got confused कि what muscle we have to say. So there are two muscles ना, एक iris है, एक ciliary muscle है. Iris दो तरह की है, sphincter pupillae and dilator pupillae. Ciliary muscles का कोई type नहीं है. So let me show you a diagram. Let me first talk about the iris muscle. Can you see? Eye is the eyeball. You know, in the eye, it is like a eyeball. I don't have diagram. Okay. So it is like this sclera. This is the sclera, and this is the cornea. It is the eyeball. Just behind this layer, there is choroid. This is the choroid. And from choroid, this is the ciliary muscle I was talking about, जो IOT maintain करेगी. And this is iris. This is iris. Iris is like a curtain, the circular curtain with a hole. So this is the diagram of iris. You can see it is a circular curtain with a hole in between. So the hole in between is the pupil. So the size of the pupil is meiosis and mydriasis. You can see in the first diagram it is normal pupil. In the second diagram, the size of the pupil is increased, so it is mydriasis. In the second diagram, the size of the pupil is decreased, so it is meiosis. It is meiosis. तो मियोसिस और मीडियासिस समझ में आया, प्यूपिल का साइज कम और ज्यादा होना, और करता कौन है वो, प्यूपिल का साइज कम और ज्यादा, आयरिस की मसल, कौन सी मसल, आयरिस की मसल. सो लेट मी टेल यू आयरिस का मसल. In the iris, we have two type of muscle. Let me draw a iris. This is the pupil and this is the iris. In the iris, we have sphincter pupillae and dilator pupillae. Let me draw dilator pupillae first. So this is dilator pupillae. This one, the radial one. ये जो लंबे लंबे मसल बना रही हूँ ना मैं रेड कलर के, all of them are dilator pupillae. Dilator pupillae. Why? Because imagine when this muscle is contracting, all of these muscles are contracting. Imagine all of them are contracting. The size of pupil will increase. So that's why these are known as dilator pupillae or radial muscles. They are radially arranged. The second one is sphincter pupillae, is in the form of circular muscles between. ये जो मैं blue color से बना रही हूँ ना, these are sphincter. They are in the form of circular. These are sphincter pupillae. So when they will contract, they will decrease the size of the pupil. So sphincter pupillae will cause meiosis. Now there is a rule. There is a rule. What does the rule says? Okay, let me think. The sphincter pupillae is supplied. The sphincter pupillae is supplied by parasympathetic nerves and dilator pupillae is supplied by sympathetic nerves. Let me see. Okay, yes, dilator pupillae. So today we are studying parasympatholytic drugs ना. So यहाँ पे दो चैप्टर आ जाएंगे आपके, कोलिनर्जिक और एंटीकोलिनर्जिक, और यहाँ पे दो चैप्टर आ जाएंगे एड्रीनर्जिक और एंटी एड्रीनर्जिक. वेरी सिंपल, वेरी सिंपल. नाउ यू विल टेल मी द होल कॉन्सेप्ट. If you have understood it, you will tell me the whole concept. You will tell me. Listen. If cholinergic drugs are there, yesterday we have studied cholinergic drugs. So they cause contraction of sphincter pupillae. So they will cause meiosis. Today we are studying anticholinergic drugs. They inhibit M3 receptors on sphincter pupillae. Sphincter pupillae having M3 receptor, dilator pupillae having alpha and beta receptors. So हमें फिलहाल M3 से concern है. So these anticholinergic drugs are blocking M3 receptor. So they will not allow acetylcholine to cause contraction. So they will relax sphincter pupillae. So they will cause mydriasis. So cholinergic drugs causes meiosis. Anticholinergic drugs जो आज का चैप्टर है, it causes mydriasis. Yes or no? Coming on adrenergic and anti-adrenergic. Adrenergic causes contraction of dilator pupillae because alpha and beta receptors are present, especially alpha receptors on it. So it will cause mydriasis, and anticholinergic drugs will do the reverse. It will cause meiosis. Let me tell you the summary. So there are 4 chapters with us: cholinergic, anticholinergic, adrenergic, anti-adrenergic. What I mean to say, what are the two muscles we all are having? So cholinergic and anticholinergic will act on sphincter pupillae. Adrenergic and anti-adrenergic are acting on dilator pupillae because sphincter pupillae have M3 receptors on it and dilator pupillae have alpha and beta receptors on it. So that's why which nervous system is involved, parasympathetic or sympathetic, you understood. Now listen, cholinergic drugs. Cholinergic drugs causes the contraction of sphincter pupillae. That's why they cause meiosis. क्योंकि sphincter pupillae meiosis कराएगी. Anticholinergic drugs causes relaxation of sphincter pupillae. So that's why they causes mydriasis. Adrenergic drugs causes contraction of dilator pupillae. So that's why they causes mydriasis. And anticholinergic drugs causes contraction of relaxation of dilator pupillae. That's why they cause meiosis. Give me a thumbs up. I tried my best. I tried hard. It was difficult. So that is the summary of iris muscle. आंख में 2 मसल होती है, अभी तो iris हुई है, अभी ciliary body और बताऊंगी. So that is the summary of iris muscle. Have you got it? Everyone give me a thumbs up now. Fast, come on. So this is the summary. If you can understand it, it's okay. But in the exam, you don't have time to apply such mathematics there. So just learn cholinergic, anticholinergic, adrenergic, anti-adrenergic. What all they are doing? Cholinergic causing meiosis, then mydriasis, then mydriasis, then meiosis. So you know na, meiosis मतलब decrease size of pupil. Mydriasis means increase size. So meiosis, mydriasis, meiosis. So it is like that. Cholinergic, anticholinergic, adrenergic, anti-adrenergic. So that is the whole mathematics. Everyone give me a thumbs up. Should I move ahead? That was the first muscle in the eye. So the whole thing is shown here. A beautiful diagram from KDT you can see here. So that was iris muscle. Coming on the second muscle, ciliary muscle. You know, I have to draw a diagram for it. I won't be able to finish the chapter today, but it's okay. We will continue it tomorrow. लेकिन concept समझना जरूरी है. You can see cornea and sclera. You can understand cornea and sclera, everyone. So this is cornea, this is sclera. You can see just beneath the sclera, there is the second layer which is choroid. Choroid contains the pigmentation. So this is the whole choroid. जहाँ पे choroid end होता है, वहाँ पे ciliary body होती है, which contains ciliary muscle, जो हमारी second muscle है. और ये iris है. Iris हमने देख लिया. ये ciliary muscle है और ये iris है. The space between two, here the iris is the pupil. ये pupil है. हमें iris नहीं पढ़ना. What I want to teach you now is ciliary muscle. Can you see this one? This is the ciliary muscle. Can you see this one? This is the ciliary muscle. So ciliary body के अंदर ciliary muscle is there. Listen, when this ciliary muscle contract, this one and this one I am marking with black. Imagine when it will contract, what it will do? It will push iris towards it. Iris को ऐसा ऐसा push करेगी. So this angle will increase. What angle I am talking about? Listen, this angle. The angle between the cornea and the iris. The angle between the cornea and iris, this angle will increase 40, 50, 60 degree. It will increase. So when ciliary body or ciliary muscle, when ciliary muscle contract, it increases the angle. So angle बढ़ने से क्या होता है? Now there are two fluids in the eye, ना? Aqueous humor present here and vitreous humor present here. Vitreous humor once of all formed by the god. It is in the form of a jelly and it is once for all. So it is given by the god only. It is not formed daily and drained daily. But aqueous humor is formed daily and drained daily. So form तो कैसे होता है? वो तो छोड़ो, drain कहाँ से होता है? Aqueous humor drain कहाँ से होता है eye में? So it is drained from these angles. From these angles, the aqueous humor is drained because these angles contain a meshwork. छन्नी जैसा meshwork है, sieve-like meshwork, which is known as trabeculi. So from that holes, the aqueous humor is entering into the veins of the sclera. Into the veins of the sclera, it is moving out into the veins of the cornea and sclera. So more is the angle, more aqueous humor will be drained out. Smaller the angle, small amount of aqueous humor will be drained out. Done. So tell me the whole summary. If ciliary muscles are contracting, what will happen? If ciliary muscles are relaxing, what will happen? Who will tell me? Who will tell me? If ciliary muscles are contracting, look at the black muscles. If they are contracting, imagine, so they will move the iris towards them. So they will increase the angle. They will increase the angle. So they will increase the drainage of aqueous humor. So they decrease IOT. So more of the aqueous humor is drained out of the eye. So less will remain here. So they decrease IOT, intraocular tension. So they are useful in glaucoma. They are useful in glaucoma. They are useful in glaucoma. And the drugs which causes ciliary muscle relaxation, the drugs which causes, they will do the reverse. They will decrease the angle. क्योंकि ciliary muscle relax होगी तो angle कम होगा. Angle कम होगा तो छन्नी कम खुलेगी. Trabeculi कम खुलेगा. कम खुलेगा तो drainage भी कम होगा. Aqueous humor का drainage will be less. So ज़्यादा से ज़्यादा aqueous humor will be retained in the eye only. So it will produce intraocular tension. So these drugs are contraindicated in glaucoma. I tried my best. I tried hard. I really tried hard. I hope you should appreciate my efforts. Done. Have you got it? Now, which drugs are doing what? Which drugs are doing what? So, yesterday I taught you which chapter? Cholinergic. Cholinergic drugs causes ciliary muscle contraction because ciliary muscle contains M3 receptors on them. These are the M3 receptors. When acetylcholine is coming, this acetylcholine is coming and binding with this M3 receptor and causes contraction of the muscle. So, and cholinergic drugs are useful in glaucoma. We have to give them in glaucoma. They are useful in glaucoma. Okay. So, what about today's chapter? Anticholinergic drugs. What they do? They just inhibit the anticholinergic drugs block the M3 receptors. So, acetylcholine cannot bind with M3 receptor. So, it is causing relaxation of the muscles. So, these drugs are contraindicated in glaucoma. So, anticholinergic drugs, जो आज का हमारा chapter है, you can see this is the ciliary body. It is shown here. Can you see? This is the angle I am talking about. So, this is the thing. So, normally, this table is for cholinergic drugs. Cholinergic drugs, iris का भी contraction कर रहा था. Iris में sphincter pupilli, not dilator. और ciliary muscle का भी contraction कर रहा था. Here, ये जो drugs हैं, anticholinergic drugs, दोनों का relaxation करेंगी. Iris का भी relaxation करेंगी. Iris का relaxation करेंगी sphincter pupilli का, so they are causing mydriasis. That is the summary. और ciliary muscle का भी relaxation करेंगी, so they increase IOT. So that is the summary. So these are contraindicated in glaucoma. So if you understood, बहुत अच्छी बात है. If you have not understood, don't take panic. Don't panic. Just learn it. Just learn it. Give me a thumbs up. Just learn it. So that is the summary for the eye. Coming on the next organ, glands. So all the glands in the body. Let me draw one of the gland for you. Okay, let me draw parotid for you. So this is the human face. This is the eye. You can see. I'm poor at drawing, huh? Don't laugh. This is the nose. This is the mouth. These are the ears. So where the parotid gland is present? Here, just beneath the ears. This is the parotid gland. On the parotid gland, which receptors are present? Of course, M3. M3 are present over the parotid gland. So normally, when acetylcholine was coming and binding with M3 receptor, it was increasing the secretion. Acetylcholine was increasing the secretion. What these drugs will do? They will block M3 receptors. Anticholinergic drugs, atropine, will block M3 receptors. So acetylcholine cannot bind with the N3 receptors, so they decrease the secretion. Atropine decreases secretion of all glands, not only parotid gland, salivary gland, lacrimal gland, sweat gland, respiratory glands, stomach glands, gastric glands, all gland secretion will decrease. So everywhere dryness is there. Give me a thumbs up if you got it. So it decreases all gland secretion, all glands. So decreases sweat gland, lacrimal gland, gastric gland, salivary gland, respiratory gland because of M3 blockage. Done. So skin will become dry, skin will become hot because sweat is absent. Swallowing may be difficult because in the mouth saliva is not there, so patient cannot swallow the food. Decrease acid in the stomach, so acidity nahi hogi, but digestion of the food will be poor. Give me a thumbs up if you got it. Give me a thumbs up again. Yes. So that is about glands. That is about glands. Coming on the next thing, blood vessels. Normally acetylcholine was doing vasodilatation. They will do the reverse vasoconstriction. So these are vasoconstrictors, you can say vasoconstrictors. And last is male sex organ. They reverse erection. Acetylcholine was doing erection, they will do reverse of erection. They will inhibit the erection, you can say, but this property is neither of utilization. Done. So that is all about it. I'm done with the action. Now will you help me for the uses and contraindication? So I'm giving you an overview. Time is limited. You can read the uses and contraindication by itself, by yourself. In the action, whatever good things are there, mark it as uses. Whatever bad things are there, mark it as adverse effect. So uses, there are 6 uses. I will tell you 6 or 7 uses. I will mark it. So the first use is based on heart. Based on heart, there are 3 uses. They increase the rate, they increase the force, they increase the velocity. Since they increase the rate, they are useful in bradycardia. They are useful in bradycardia. Since they increase the force, they are useful in MI. Since they increase the velocity of conduction from SA node to AV node, they are useful in heart failure. So there are 3 uses: bradycardia, heart failure, and MI based on heart. Give me a thumbs up. So heart pe 3 uses ho gaye. 3 uses heart pe ho gaye. This is the first property. Second property I will take is GIT. In GIT, they are causing retention of the feces. So they are used as anti-diarrhea and they are used as anti-spasmodic because they are relaxing the muscle and contracting the sphincter. Give me a thumbs up. Give me a thumbs up. Everyone give me a thumbs up. So that is the thing. So they are anti-diarrhea and anti-spasmodic. So 2 uses based on GIT. 3 were on heart. Coming on the third use is urinary bladder. Based on urinary bladder, only 1 use anuresis because they cause urinary retention. So they are useful in anuresis. यहाँ पे uses में बीमारी का नाम बोलो. ड्रग उल्टा करेगी. बीमारी है एन्यूरिसिस तो यूरिन ज्यादा आ रहा है, ड्रग यूरिनरी रिटेंशन करेगी. बीमारी है डायरिया, ड्रग एंटी डायरिया करेगी. बीमारी है ब्रेडिकार्डिया, ड्रग टेकिकार्डिया करेगी. So what is the disease? Drug will do opposite to treat it. Done. So here the use is anuresis. So urinary bladder में एक ही use है anuresis. You know that other name of anuresis is bedwetting. I'm not explaining again. The fourth use is okay, glands. Based on glands, where we use this property, they are decreasing secretion of all these glands. So where we use this property at 4 places. Some person is having peptic ulcer. So he's having more acid in the stomach. Now we want to decrease the acid. So in peptic ulcer, we can give this drug. Some person is having coryza. You know what is coryza? Naak behna bahut zyada, sardi ho jana, coryza. So coryza में the nasal secretions are more. Nasal glands are overactive. We want to decrease the secretion. Give these drugs. Give these drugs. And we want to, some person have excessive salivation in the mouth after poisoning or in Parkinsonism. We want to decrease the saliva. So we can give this drug. Yes. So, and before anesthesia, we want to decrease the secretions all over the body. So we can give this drugs. So excessive salivation, peptic ulcer, and what else? Peptic ulcer, excessive salivation, coryza. So these are the uses based on glands. Coming on the next use is based on eye. In the eye, it is causing 2 things. It is causing mydriasis in the eye. So where the property of mydriasis is utilized? Have you go for your ophthalmic checkup? All of us have specs, yeah, right? So whenever we go for an ophthalmic checkup, doctor first puts some drop in our eye, then check the eye. So that is a mydriatic. So for refraction testing or fundus testing, first mydriasis is done. Can you see the pupil of this person? It is dilated because of putting these drops. So mydriasis is utilized there, and it is contraindicated in glaucoma. Glaucoma will be in contraindication, not in uses. So that is eye. Last use is CNS. In CNS, I have taught you 2 uses. One for blocking basal ganglion, it is used for Parkinsonism. One by blocking vestibular apparatus, it is useful in motion sickness. Give me a thumbs up. So these are the 6 uses. 6 uses. So after that, 2 adverse effects are there. You can read it by your own. The one is asthma and another is glaucoma. So two adverse effects or contraindications are there. You know the reason. So 6 uses plus 2 adverse effects. So blue one are the adverse effect, red one are the uses. This is the way to learn it. Time is limited, so I have to run. So thank you very much. This is the summary of the ANS. This is the summary of cholinergic drugs. Yesterday I told you 9 uses plus 4 adverse effect. Today in anticholinergic drug I have told you 6 uses plus 2 adverse effect. So count 9 circles and 4 circles here. Count 6 red circles and 2 blue circles here. This is the way you have to study. समझने वाले समझ गए. So I'm moving ahead. So time is limited. I'm having another lecture at 10 o'clock.